In this video, we'll be looking at a use case on how to use the dashboard. The use case we'll be exploring today is running a vaccination clinic for H2A farm workers in Fresno, California. Now, the most recent data that we have for H2A workers is 2023, and we're interested in looking data across the entire year. As you can see, we're in the H2A population section and on the state map. And as you can see, we can highlight Fresno County, which has 1,220 total H2A guest workers present. And the percent of all H2A workers present in the state is 4%. In order for our vaccination clinic to be successful, we would ideally like to go at a time where there are the most amount of farm workers. As you can see here, October seems like the best time, as there is a peak of 1,089 farm workers. Now, we know that this is data for 2023, but this data can serve as a good proxy for when to plan future trips. In terms of when farm workers are arriving, a good time to have the clinic would be just as they get there in April or May, or when the highest number of H2A guest workers arrive, which is in October. In the next part of our use case, we'll be looking at the farm worker map here, the locations and resources section. Now, since we're particularly interested in Fresno, California, those are the two selections that we made for select the county and select the state. Now, if we're trying to set up a mobile vaccination clinic for farm workers, the first two sites that we'll be looking at will be H2A housing sites and H2A work sites. In the layer section, please ensure to have both of these selected. Now, as we get into Fresno, here, we'll be looking at different sites. So, let's say we set up our mobile vaccination clinic here at this H2A housing site. Now, here, we can see that the total occupancy is 236, which means we may be able to vaccinate up to 236 H2A farm workers at this specific housing site. One key metric here is you can see that I set up my H2A employment begin date and H2A employment end date. So if a housing site started at any point last year in 2023 and goes up to March 2024, and the end date is set up for the first 3 months of 2024. The reason for this is we'd like to catch farm workers and talk to them during the cooler months of the year. Our campaign wants to avoid going into Fresno, California during the hot summer months. Now, next, we'll be looking at the H2A work sites. So, we just saw an H2A housing site, and at the work site nearby, you can see that if we went to this work site and set up our mobile vaccination clinic, that we potentially could only reach one H2A farm worker, since that is the total H2A worker certified number for this specific work site. So we may not want to go to this specific site if we don't expect there to be that many farm workers. One other interesting thing to note is we might want to coordinate with either the health centers in the area or the National Farm Worker Jobs Program sites. So, as we zoom into Fresno, you can start to see the other organizations that we might partner up with in order to make sure that we're reaching the most amount of farm workers. So here, we might partner with United Health Centers, Crescent View, in order to be able to talk to as many farm workers as possible. In this way, we can ensure the success of our mobile vaccination clinic for farm workers. Thank you.